would like to introduce our speaker for tonight. Okay, and when it comes to his background, okay, nakita nyo naman from school pa lang. Alright, he was a scholar at Manila Science High School, Dean's Lister in pre-med UST, awardee and organization leader, UST Medicine. And all of these trainings, from U.S. Air Force, Clark Air Base, and Makati Med Center, Natural Medicine in San Diego, California, Herbal Oriental Medicine in Malaysia, German Homeopathy and Chelation Therapy. Okay, and also he's part of some organizations like American College of Lifestyle Medicine, okay, and Royal Society of Alternative Medicine in Singapore, Philippine Medical Association, he's a member, PTAC DOH, Health Devices Committee Chair, Chamber of Herbal Industry Director, Philippine Society of Oncology, he's a member there, and he's a former Grand Chancellor of UST GBE Med Fraternity. Wow, ang daming nasa waiting room. We already have 120 people in the call right now. And he's also the medical director of Libyan Medical Group, and he has written some books like The Great Anxiety Escape and The Detox Benefits and Procedures. Okay, not only that, Boyet, meron din siyang media exposure. He has a regular programs sa DZRH, DZBB, DWIZ, and also TV5. Okay, so let's all welcome. Alam niyo naman dito sa new image, pag wini-welcome natin or pag excited tayo, we type 11111. Let's all welcome Dr. Edwin Bien. Hi, Doc.
Hello, Doc.
I'll ask you to...
Hi there. Hi.
Hello, Doc.
Hi, and thank you very much for having me here. Of course, I'd like to thank first our country manager, Sir Boyet, and the one responsible for inviting me over for many months already.
Yes.
Miss Kate Sadenyo. So thank you for your persistence. Sabi nga nila, success depends on persistence.
Yes,
diba?
That's right.
And of course, since I received a message also from our chairman of the board, Sir Graham Clegg, thank you very much for the opportunity. And to everyone who's here, maraming salamat po for tuning in. At sana I can share with you something na you might find it beneficial for yourself and for your loved ones. Okay, thank you. I think the first slide would be a picture of our chairman. I read it. It's very impressive. And whenever I see him, talagang nai-impress ang marami because of his energy despite, his advanced experiences here on Earth. Very energetic pa rin siya and jumping from one country to another. And his concern really is to make people healthy and to help people become successful through health and the products that he is endorsing. So again, our gratitude to Sir Graham Clegg. I don't know if you are going to be seeing this, but hopefully you will.
Yeah.
Okay. There's another gentleman, probably about the same senior year with our chairman, who is a very big influence, who has a very big influence on why I went into the natural medicine approach. And the next slide will show you that. And this time, I'd like to show my gratitude to this gentleman. And that would be, okay, next slide, please. Ayan. A lot of you have probably heard about him. Siguro, yung mga kaidaran ko, naabutan siya. There was a time that he was the most popular senator. But before he became a senator, he was a very, very nice Department of Health secretary and people follow him. And that is Dr. Juan Clavier. Siya yung nagsabi na, let's do it. And actually, he was pushing for natural medicine dito sa bansa natin. Pero he made a very big impact not only to me, but to a lot of doctors as well. Ito kasi yung kanyang point of view. Ang sabi niya sa akin, bien, and that was when I newly graduated, at least mga 2 or 3 years only into medical practice. And I'm doing the regular medical approach in the hospital, no? And prescribing a lot of the synthetic medicines. Ang piniprescribe ko would be syempre mga insulin to lower down the blood sugar, antihypertensive to lower down the blood pressure, and suggesting chemotherapy and radiation, and then surgery to people with tumors. And he said, do you think magiging permanent ang cure with those things that you are giving? Sabi ko, di ba yun ang itinuturo sa school? And he said, that is only part of the treatment. Because people cannot live on medicines alone. People need nutrition. People need food. And preferably, people will need supplements that are natural. And that opened my eyes. So I followed him. By then, he was a Secretary of Health. And then I am very grateful and lucky because he is so much into media. He is in television, he is in radio, and he was getting me involved in his projects. So, swerte ko. And together with me, makikita nyo dun sa picture, is a very beautiful lady who's also into natural medicine. Although she's not a doctor, Miss Cory Quirino is very much impressed also with the way things are happening in the Department of Health during that time, about 37 years ago. So when he became a senator, he made a law. And that law is the only law he made, called Republic Act 8423. But that paved the way for all these supplements, all these natural products opening up in our country. And if you can take a look at his picture on the lower right side, I was with him on his very last few days here with us. Ayan. So, he just died of old age, healthy, at the age, I think, of almost 90. So, that is how I started into not only prescribing the medicines that you see in the pharmacies, but mixing it with a lot of natural products. Did it help? The next slide will show you. So ito ang sinabi sa akin ni Dr. Clavier. Bien, this is the medicine of the future. The people will open up their eyes. Ang sabi ko 30 years ago, magdidikdik ako ng pito-pito? Magdidikdik ako ng dahon-dahon? Yun ang irereseta ko. And then he said, no, just wait for it. Because people in Europe, people in advanced countries like Japan, Australia, Taiwan, Singapore even, and many other ASEAN countries are already incorporating itong natural medicine with our own synthetic medicine. So I follow yung Hippocrates saying na let food be thy medicine and medicine be thy food because nature is the best physician. Next slide, please. So this next slide will show you that even the most popular people in the United States are also into natural medicine. Gaya ni Oprah, who got Dr. Oz as part of her program, which later on has his own program. So I delved into it. I went abroad. I studied some more and learned about this procedure. This procedure in general term is called homeopathy. And that is the use of natural products together with your usual medicinal products. Did it help?
Yes, of
For
course.
myself, it did. Thank you, Sir Boyet. Take a look at the next slide. You will be surprised because this will be our big topic later on. I developed COVID, and this was in the middle of July.
Wow.
I got well naturally without having to be hospitalized, without taking all those very expensive medication that has to be injected on me. without having to be admitted to the ICU. And just by myself, taking a lot of these natural products and nutrition for myself, I was able to recover. But that is only recently. For more than 35 years that I have been practicing, I have been using it not only for myself, for my loved ones, for my family, but also for a lot of my patients, which you can see in the next slide. These slides can be found in my YouTube channel. As you can see, a lot of people who come to our clinic are usually cancer patients. About 70% are cancer patients. Why? Because at the present time, the treatment that are being done for cancer are, first, they cut it off, but there is a chance that it might spread. Second, they have to cook with radiation the cells that might have spread. And if the doctors are not sure, they have to inject some chemicals called chemotherapy so that they may be able to kill the cancer cells. But you very well know na yung mga may cancer still dies from cancer if they just follow those three regimen. And the quality of life that they get is not a good quality. They may be given 2 or 3 years of added life, but with a lot of suffering. And why? Because if we rely only on those kind of medicines and treatment, you may be able to kill the cancer cells, but definitely also kill a lot of the normal cells. So nakikita nyo siguro yung mga nagki-chemotherapy, nagra-radiation, they get very thin. They lose their hair. Namumutla sila, nagsusuka sila. And if they're given a prescription for about 6 cycles of chemotherapy, at the end of the second cycle, a lot of them would quit. Now, some doctors are saying, well, that is the standard that we are going to give because that is hospital medicine. But you know, a lot of people who are very popular, who has cancer, succumbed even when they did those treatment. Our former president, a lot of the celebrities, a senator from Iloilo who is very popular, and not only here but as well as abroad. So what is lacking? Yun nga ang sabi ni Dr. Flavier. Kailangan may pansuporta tayo sa nutrition so that the body can recover. Because the body does not thrive only on medicine but on nutrition to rebuild and regenerate the cells. So I hope with that introduction, ang haba ba, already you will be realizing, ay, oo nga ano, hindi lang COVID, there's still a lot of people with cancer nowadays. There's more diabetic people than COVID patients. And definitely, more than 70% of Filipinos will still succumb to either a heart disease or a stroke. Dahil yun pa rin talaga ang mga number 1 cause of morbidity and mortality in our country. So wag nating kalilimutan yon. However, everybody for the last 2 years, almost 2 years, ang focus na lang, COVID, 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 COVID. Ang hospital daw, I say daw, ay punong-puno ng COVID, 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 and COVID. But, honestly, ang namamatay sa COVID, and I'm not trying to downplay this, about 24 to 27,000 for the last 2 years. Did you hear that? Less than 30,000 people. Now, if you take a look at the statistics, how many have died from heart disease? In a year, it's more than 200,000. How many are suffering from diabetes in our country? 8% to 10% of the 100 million Filipinos. So ilan yon? That's 10 million Filipinos. Those numbers are still much, much bigger than the dreaded COVID. Nakuha nyo? So, let us not focus only on COVID. Let us also focus that we will be meeting a lot of people with varied diseases that are chronic and degenerative. Dapat, tinutulungan din natin sila. And since hindi naman makakaya ng mga doktor ito lahat, especially if that doctor is not nutritionally inclined, then I would like to rely on the more than 100 people who are with us here in Zoom right now. Pwede ba yun? Is that agreeable?
Pwede, Doc.
Yes.
Yeah, that is the reason why you are here. That is the reason why you are watching now. You are going to learn something because that is not only for you, but that is something that you can share with others. At may nagsabi sa akin nung araw, when I was just starting, yung tatay or father ni Ronnie Ricketts, his name is Max Ricketts, we co-authored the book together in the US. Sabi niya sa akin, Edwin, if you only save one life, that is already worth the more than 10 years of study that you did. And now I realize, totoo yun. Very, very much true. So, if you're watching this, even if you're not a medical doctor or in the medical field, you can help a lot of people. But let's go to the dreaded SARS-CoV. Next slide, please. In 2019, we saw some pictures on social media of people falling down in one country nearby, one of the biggest country in the world. Nagulat tayo, nahihimatay sila. Pero parang hindi naman natin yun nakikita na sa ngayon. Was it a reality? We do not know. No, but that is the time that they blamed eating bats because these bats and other exotic animals harbor, as they say, a certain virus that can jump to humans and can cause an illness. And this virus is called the SARS-CoV-2. Well, maybe it came from bats, maybe it came from the snakes, or maybe it came from the laboratory. We do not know. We actually do not know. What we know it is affecting a lot of the people. And why is it affecting a lot of the people? I will mention some keywords that you will meet these keywords again. One, because it has a protein. The protein is in the form of a spike. Nakikita niyo yung spike on the screen? And that spike is the one that will attach to the throat where we have receptors. Ang tawag sa receptors sa throat natin are ACE receptors. To aid the attachment of the protein in the ACE receptors in our throat, it is coated by a lipid membrane. When we say lipid membrane, mantika yon, taba yon, nakabalot doon sa protein. Do you follow? Lipid is a form of fats. The one that is colored purple on your screen, ayan, nakapatong siya on the protein. You know what is nice to hear? Ang mga bata, bihira pang magkaroon ng SARS-CoV because I think those who have children here will be happy. Hindi pa masyadong develop ang kanilang ACE receptors in their throat. So, pag pumasok yung virus, only very few can attach and most will just go out of the body. Now, bakit yung mga may comorbidity are the ones that are usually affected? It's not because of the virus, but because this virus will attract a secondary infection. It is called a bacterial pneumonia. And it is the pneumonia that causes death to a lot of the people. It's not the virus per se, but the pneumonia accompanying it. You follow? So, let's skip a little bit about this virus kasi sabi ko nga sa inyo, it's still only a very small portion of what we see in the hospitals. We see a lot more. And a lot more are these slides. Next slide, please. Cardiovascular diseases. Do you see the arrow? That arrow is pointing to the Philippines. The Philippines is colored orange. Okay? And if you take a look at the left side, you will see the color orange means we are in the middle of a very high incidence of cardiovascular diseases. The highest would be red, as you can see on the map. But we are almost into the red portion. Why? because of our habits, because of our eating habits, because of the food that we choose to eat. And a lot of us rarely exercise. So, ang cardiovascular diseases natin is very, very high. Please take note of the number. 70% approximately. That means, sa 10 tao, 7 ang pwedeng atakihin sa puso or magkaroon ng stroke. Kung 100 tayo ngayon dito sa Zoom, 70 of these people might suffer a hypertension which can lead to, again, a heart attack. So, napakataas naman. Next slide, please. This next slide, you will see, ayan, can we show? About diabetes. Again, you will see the arrow. Ang taas pa rin ng incidence of diabetes in our country. Lahat kasi sa atin matamis. Ang spaghetti natin matamis. Ang hamburger natin may asukal. We
Yes.
put sugar in everything. Pati ba naman yung adobo natin, we are very proud na may asukal. Hindi ba?
Ang sarap eh.
Yon ang dahilan. Tingnan natin ang spaghetti. If you buy your spaghetti sa, let's mention a local, wag na lang yon, sa Italy, maasim ang spaghetti. Pero dito sa atin, ang local spaghetti doon sa paboritong pasyalan ng mga bata, napakatamis, hindi ba? Parang ketchup ang sauce nila, hindi ba? Because
Yes.
we have been conditioned since young, since our youth, na tayo ay dapat matamis ang panlasa. And that is why we develop a lot of diabetes. People do not die from diabetes, but from the complications of diabetes. And ano ang number one complication of diabetes? Again, it goes back to cardiovascular diseases. And secondly, yung problema sa kidney. So, dapat tulungan din natin yon. And last slide on this one, can we go to the next one? Malignancies or cancer. Again, if you take a look at our color, it is pink. And if you take a look at the other arrow, pink is right in the middle of a very high incidence. Do you know that we are number one in breast cancer in the whole of Asia? We have more breast cancer in our women than China. Imagine the population of China versus the population of the Philippines. Imagine India has more people than Philippines, but we have more women who has tumors in the breast. Scary, hindi ba? Now, let us go back to the 1920s, 1930s, or 1940s. Kapanganakan ng mga lola at lolo natin. You will rarely hear ang grandparents natin namatay dahil sa cancer. Namamatay sila dahil sa katandaan. Cancer? No. High blood pressure? No. Karamihan sa kanila, low blood pressure. Diabetes? Ang papayat nga nila noon eh. Ngayon lang tayo talaga nagtatabaan. So these are our illnesses na dapat matulungan natin. Okay? So, let's jump again to our concern, which is the immune system. Next slide, please. Yan, tadan. I have entitled it, The Confusion. Hindi ba kayo litong-lito na? Nag-MECQ, GCQ, ECQ, at lahat na lang ng ESQ. Hindi sila nakontento, nagkaroon ng level 1, level 2, level 3, level 4. I have a surprise for you. May level 5, pero magkakaroon ng hard and soft. Ha? May hard level 5 and soft level 5. That means ang tao nakapreso. This slide will show you na ang virus will always be here. But the illness does not necessarily have to be here. Do you follow me? The virus can always be here, but the illness does not necessarily have to be here. Let me take you back in 1918. In 1918, nagkaroon ng pandemic. Of course, a lot of you have been reading about it, di ba? Take a look at the images sa Google of 1918 pandemic. You'll see people wearing a crazy shaped face shield, curtain cone. They're also wearing masks. There are a lot of people dying. Now, I'd like you to Google 1921. Go to the images. If you are in your computer right now, go to the images. 1921. Do you see people wearing masks or face shield? No. They are already outside. They have a normal life. In fact, that is what they call the era of the roaring 20s. That is the time when Hollywood became a boom. So that is 3 years. 1918, 1919, and 1920. We are nearing our third year. So that means, huwag tayong madesperado. There is a way to get out of this pandemic. Now, why are we so afraid of this pandemic, of this virus? Is it because of the virus that we are afraid of? No. Let's go to the next slide. Hindi naman kayo takot o tayo takot sa virus eh. Nakakita na ba kayo ng mga taong naka-face shield ang buhok at naka-mask ang baba? There's a lot of them. Hindi sila takot sa virus. Takot sila doon sa cost of getting sick and being hospitalized. And that is the real fear. Takot silang matubuhan, the intubation, dahil alam nilang pag natubuhan sila, they are into the 50-50 category. 50-50. And ang cost of 200, 300, up to 1 million pesos, that is very difficult to pay off. Take a look at the price of remdesivir. It says here, $3,000 plus. That's a lot of money. Hindi ba? $520 per remdesivir. That is 25,000 pesos. And how many will a person need? About 5 of this to 6 of this. That is why umaabot tayo ng halos kalahating milyon. And that is what we are afraid of. And that is why we are here. Because there is a way. We can get sick, like I got sick, but there is a way not to be intubated, not to be admitted to the ICU, not to be hospitalized, but to rely on your immune system. And that is in our next slide. This is the true solution. We have to activate our immunity. It is called immunomodulation. We activate it because our body has been given a God gift of natural immunity. Meron naman tayo talaga nun eh. Bumababa lang sa maraming kadahilanan. We eat all the wrong kind of foods. We entertain in our body a lot of television, a lot of social media. Some of you listening here probably are still playing Mobile Legend at your age. 40 na, naka-Mobile Legend ka pa? O naka-Clash of Clans ka pa? Ano ba? Tama na yung kapanahunan natin na naglalaro tayo ng ano ba yung ching, 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 ching. Ginagano natin, tama na yun. That is for the teens. Okay, di ba? And last but not the least, we put a lot of acidity in our body because we entertain depression, anxiety, na wala namang nakakagamot dahil it is up to us to take care of it. So, how do we take care of it? Through one of a very good food or substance. Let's see the other slide. Our mother gave this to us. It is sad to hear mothers not breastfeeding their children. Kasi walang lumalabas na gatas eh. Pwede mo bang sabihin yon sa kambing o sa kalabaw na walang lumalabas na gatas? So yung anak niya kailangan makadede sa iba? No. It is a natural process na gagawa ng gatas ang isang tao. Pero hindi yun ang kadahilanan usually ng mothers. A lot of mothers are saying, kasi I'm working. Kasi masisira yung figure ko. Madedeform. And we are depriving children of a very nutritious substance which comes out on the first week before the actual milk comes out. And that is called colostrum. What is colostrum? It is a substance that is full of natural microorganism fighting antibodies. It contains all the proteins that is needed for a child to thrive. Whether animal or whether human or animal, this child will thrive more when given colostrum. We have seen a lot of children develop asthma and allergies kapag hindi sila pinadede ng nanay nila. Now, on your left screen, you can see the benefits of colostrum. Less ang diarrhea of children, less of respiratory tract in children, less ang inflammation, and surprisingly, less ang chance to develop cancers later on. Excuse me. But as adults, we cannot get colostrum. So we have to source it from somewhere else. The next slide will show you that there are available colostrum. And one of the most potent is the one that contains the alpha lipid. The science of lipids will show you that these fats, cells of bilayer sheet, will make the colostrum more absorbed inside the body. Do you remember the lipid that is enveloping the SARS-CoV? That is a technique for it to enter the body. Now, the alpha lipid is another technique for it to be absorbed in the body. So this is actually a technology. Hindi kamukha ng iba na they just say it is an ordinary colostrum. The alpha lipid makes it a better absorbed substance. And next slide will show you that. Pasensya na, this is a little bit technical, but as I have entitled it, remember the lipid membrane? The one on the right side, the picture, is the process by which the lipid enters our cells. It goes into the specific organelles. Sorry about the technical term. And do you see the parang may zigzag road there? It is called the mitochondria. The mitochondria is the powerhouse of the cell. It produces our energy. So if it enters our body, we have the energy. And that energy is produced called ATP. ATP is the one responsible for making our white blood cells active. And you know what is white blood cells? It is like a Pac-Man. It goes around our circulation to fight off offending organisms, viruses, bacteria, fungi, and even tumor cells. So, what am I trying to say? We need this lipid to enter the cell. Next slide, please. So, prevention is the key. A lot of people are so afraid that they get themselves injected, thinking that it's going to give them 100% immunity. But even doctors and scientists are saying, don't bet on the vaccine to protect us 100% from COVID-19. We have heard a lot of vaccinated people is still hospitalized. And they say na yung vaccinated people will only develop mild symptoms. No. Ang dami dyan. Nasa social media. Yung iba, military people pa. Yung iba, celebrities pa. They develop moderate to severe. At kapwa ko mga doktor pa. And that is something that is troubling for us. That means vaccine is probably one way, but it is not the only way. It is not even 100%. We need something to protect us. Sa palagay nyo ba, it is the mask and the face shield? No. Do you think the virus, this is funny. We enter a mall, we have to wear a mask and a face shield, right? But if we turn left and we go inside the restaurant, wow, we can remove the mask and the face shield. So you think the virus does not have a key to enter the restaurant? So do they make a U-turn? Kasi sabihin nila, ay, pumasok na sa restaurant, nakaupo na, bawal nang ma-infect ang taong yan. No, the virus is still everywhere. Even if we're wearing a mask, it can enter through the sides. It can enter through our skin. So we still need a prevention. And that prevention is a good antioxidant, a good antimicrobial, something that will promote our antibody. Next slide, please. This is something that we desire that our body will produce. It is called immunoglobulin. They are the antibodies. There's IgG, IgA, IgE, IgD, and IgM. All of those fight off all the microbes. It does not come from the outside. It cannot be injected to you. It has to be produced by our own body. I'll give you an example. Perhaps dito sa 100 plus who is with us right now, maybe 70% are parents already. Are you? Are you parents already? Do you remember when you have children and you want your child vaccinated at yung anak mo is about 2 years old or less and you go to a pediatrician para pabakunahan ng anak mo dahil maraming bakunang kailangan like oral polio, DPT, MMR. But if your child has cough or cold or having diarrhea, anong sasabihin ng pedia? No, you cannot do vaccination now. Come back kapag malakas na yung katawan ng anak mo. And you know why? Because vaccination means they will inject a virus into your body or a portion of the virus or a memory of the virus. But it is not the injection itself that will fight the COVID. The body has to react to the one that is injected. And the reaction will be through an immunoglobulin. But what is happening right now? Everybody's encouraged to get injected. People undergoing chemotherapy. People undergoing dialysis. People with blood pressure na 200 over 100. Diabetic people with sugar that is 250. Everybody's encouraged to get the injection. Now, how will they be able to produce their antibody of immunoglobulin if their own body is weak? I hope you follow. So how do you make that body strong? By providing a very good substance. I hope you're getting the drift. What is that substance? It's on the next slide. It is called lactoferrin, and it can be found in colostrum. It is part of the transferrin family. It is a protein that goes inside our body and together with the sunshine will give us a herd immunity. Now, this is difficult for us because with all the lockdowns, we are inside our rooms. We are inside our houses. Swerte yung mga tao na mayroong balkonahe. Swerte yung mga tao na ang bahay nila has a sunshine. What if you are living in an apartment or worse, in a condominium where you do not get the sunshine? Then the sunshine cannot react with your lactoferrin and you do not develop immunity. Think of the cows. The cows produce the colostrum. But if this cow is naturally grazing on the grass, walking around, they are definitely healthier than the cows that are only inside cages. And that is the same for our body. We must get lactoferrin and we must get vitamin D. And sunshine is the best source of that vitamin D. Next slide, please. Okay, the next slide will show us we gain wisdom. If you can see here, in 1918, in 2021, they got back their freedom. I would like you to Google this yourself. Try to look for people in 1921, in 1922, 1923 that are still wearing the mask. No one. And why? Because they are rich in proline-rich peptides. In the 1920s, they know the wisdom of colostrum, but we do not right now. So I hope I have encouraged a lot of you who knew about the wisdom. Share it to other people because this is antibacterial and antimicrobial. It helps support our different glands, the thymus gland, the adrenal gland, and our elimination system glands. Next slide, please. So, aside from the immunity that it can help provide against the virus, it can also help provide protection from many other illnesses. See the digestive area there? To prevent colon cancer, to prevent liver cancer, to prevent GERD or hyperacidity. You see the guy playing football to provide us with energy, to provide us with zest for life. Do you see the lungs? To give us a better breathing capacity. And that is the protection that can be found with our growth factors. I hope you get the drift. Now, a lot of people are saying to me, Doc, bakit ang mga doktor ang galing magbawal pero hindi alam kung ano ang dapat naming kainin? Do you remember doctors will tell you, oh, bawal ang ganito, bawal ang ganito, bawal ang ganyan, huwag kang magpiprito, bawal ang mamantika, etc. But when you take a look at the list, parang wala ka nang kakainin kasi yung doctor will not tell you what are the food that you should eat so that you also gain an immunity that will help your colostrum. I'll give you some. Next slide, please. Wow! Food as your medicine and vaccine. Galing kay Hippocrates again yan. Let your food be your medicine and medicine be your food. Kasi ang food has the power to heal us. Sabi nga dito, it is one of the most potent tool we can use. Diba? Next slide, please. Wow! Salmon, tuna, and other oily fish. Better than your bacon. Broccoli. I didn't know broccoli could be also chopped very finely and made into a replacement for your 3 cups of rice. Marami sa atin, kulang ang 3 cups of rice kapag ang ulam kare-kare, hindi ba? Broccoli can replace some of those cups of rice. Next slide, please. Wow! Sweet potatoes kesa doon sa paborito nating pandesal o tinapay. Green leaves like spinach. Bihira sa atin ang mahilig sa gulay. They contain flavonoids, they contain beta-carotene, and a lot of the nutrients. Next slide. Wow, ginger as a drink also is very good. Garlic is also very good. Next slide. Green tea is also something that we could drink. Kesa yung mga mamahalin na sinisigaw yung pangalan mo kasi sinusulat mo yung name mo doon sa cup and cost you 150 pesos. And when you add muffin to it, you'll be spending about 220 pesos, almost half of your salary for that day. Grabe, no? I cannot imagine why that brand of coffee can cost that much. Next slide. Nuts and kiwi. Those are very good also food that we can choose to eat daily. Next slide, please. And, of course, to couple that with a drink that has helped a lot of my patients. Just today, in my clinic, I have prescribed it. I had a breast cancer on the left on an 80 plus year old woman. Recently, about I think 2 days ago, someone came in with gastric cancer, and again, it was prescribed to that patient. And another patient who received it, this is someone who has a lot of the joint pains because of gout and osteoarthritis. So you can see this can be added to a lot of the prescriptions, even by doctors, but not necessarily doctors alone. Next slide, please. There are some people who does not want to take it in powder form, and there are some capsules form. So even for children, you can open up the capsule and mix it with their drink. And this would be good for children to prevent a lot of illnesses as well. Last slide, please. With all of those things, the good food, the nutrition, the positive mental attitude, and a very good supplement, let us not forget that our spiritual belief, our spiritual growth plays a very big role in the prevention of illnesses or to help you get well, whatever you may be afflicted with. Huwag nating kalilimutan yan. I hope I have taken so much of your time, but you have learned something. I thank every one of you. I wish you a good evening and may God bless all of you. Salamat po.
Wow, thank you very much, Dr. Bien. Ako, talaga naman overwhelming yung mga information. Mukhang yung mga leaders namin will not be able to sleep tonight. Kasi lahat ng mga sinabi nyo will resonate to them. Ako, talaga naman napakaganda. Especially yung mga strong beliefs namin about colostrum, na-validate lahat. Na-validate lahat when you shared to us all the info, all the medical studies about colostrum. And also, surprisingly, kasi lahat tayo puro COVID ang pinag-uusapan eh. Mas marami pala ang cancer cases, diabetes cases than COVID. Eh lahat kasi ng dyaryo ngayon, or online na social media, puro COVID eh. Kaya akala mo, mas maraming cases ang COVID. Talaga naman. Tama ka, I believe you, Dr. Vin. Anyway, nandito na tayo, Doc, sa question and answer segment ating meeting. Marami kaming mga natatanggap ni Cynthia ang mga questions dito na gustong ibato sa inyo. No? Number one question, how different is immune protection coming from Alpha Lipid Lifeline compared to other supplements like vitamin C, zinc, etc.? And meron pang follow-up question, how superior it is, especially during COVID-19 pandemic?
Well, the first question can be answered very simply. It is the first food that we take as babies. That means the colostrum, when taken by our body, is the first food that we are exposed to. Yon ang kagandahan nun. So tatandaan natin, our body is made for it. All mammals are made for it. Therefore, it is more superior than the recently developed, especially if it is synthetically produced vitamins and minerals. Remember, it is natural. Second question, bakit malaking tulong siya against COVID? Because it is giving our body a product that it can build on. Alam niyo yung cells natin, it keeps on rebuilding and rebuilding and regenerating. I'll give you a good example. Supposing nasugatan tayo sa kamay. Mayroon tayong malaking hiwa sa kamay.
Mm-hmm.
As long as that wound is clean, you will notice it slowly repairs itself. And one day, makikita mo na lang, 2 weeks later, healed na siya with a scar. That means the body uses building blocks so that it can repair and regenerate. ganon ang ginagawa din ng colostrum inside our body. It acts as a building block because it is the first food that we are used to. And it can provide the lactoferrin, the transferrin, so that we produce the antibodies against these viruses. Actually, hindi lang viruses, pati bacterial infection from pneumonia to tuberculosis to other problems that can affect our skin and our internal organs. So I hope you realize it. It becomes a building block of our body. That is the key word.
Thank you, Doc. I'm sure, naku, happy-happy yung mga nagtanong na yan dun sa mga responses nyo. Cynthia, meron ka bang natanggap na question dyan?
Yes, Doc. We always see posts na that colostrum is actually an oral vaccine. So the question is, does this mean that, kasi yung iba ayaw magpa-COVID vaccine, di ba? So does this replace COVID vaccination?
Let us not say that it is an oral vaccine, no? Kasi if we say that, baka it might affect, the product and it will reflect not only on the product but on the company itself, no? Ang suggestion ko, you seek the advice of your doctor, especially if you have comorbidity. And then you get a second opinion or even a third opinion if need be. But ito ang payo ko. Use it together with whatever your doctor is going to suggest and prescribe to you. For example, you have high blood pressure and the doctor will give you amlodipine, losartan, and many of these generic drugs.
Micardis.
That's a brand.
Ganun ba?
That will lower your blood pressure, but only as long as it is in your body. As long as it is in your body. So that means you have to take it again the following day. Sometimes you have to take it even twice per day or 3 times per day. Kasi mabilis siyang ilabas in the body. But does it prepare any damage to the heart? No. Does it prevent a blood clot inside your blood vessel? No. It only lowers down your blood pressure. That is why you need a good supplement to complement that medication. I hope yung mga may alta presyon will realize this.
Okay. Thank you. Thank you, Doc. Question dito. Medyo pointed yung question. Are you taking colostrum, Doc?
Yes. I have known the product about 6 or 7 years, I think, already. So I have known about it, but the beauty is now there is an alpha lipid form. Dati kasi, honestly, 30 plus years ago when I graduated, I only know colostrum coming from the mother, human na colostrum. But now we realize na meron palang technology to make it easily absorbable. So we are lucky that there is such a technology.
Yes, Doc, pinapatent ng New Image International yan, yung alpha lipid.
Wonderful.
Cynthia, meron ka pa dyan?
Yes, Doc, ito. May tanong sa chat box, no? For dengue and yung isa naman COVID, what is the recommended dosage daw ng ating alpha lipid lifeline colostrum?
Okay. People are afraid of COVID. But actually, mas dangerous ang dengue. You know why? Kasi once a person develops the hemorrhagic fever, magdurugo na ang ilong, magkakaroon ng internal bleeding, and the treatment is nothing except blood transfusion of platelet. And we see a lot of people dying from it. Compared to COVID, na 98% ang recovery rate. Only 2% to 3% will go into the moderate and severe form. However, ang dengue has a very big chance of going into a hemorrhagic type of fever. So, regarding dosages, There is no overdosage on this. If I will recommend 1 scoop to 2 scoop 2 times or 3 times a day while a person is sick, so much the better. And then once a person is getting well, then you can lower it down to a scoop twice per day and later on once per day. It depends on the body and the people taking it. There is no overdosage for it.
Okay. Another question, Doc. Is alpha lipid colostrum safe for patients with leukemia? Some doctors
Definitely.
say taking probiotics daw is not good for those who have leukemia.
All forms of cancer means the body is going haywire. Nagkakaloko-loko na ang production of normal cells. What is produced are immature cells. Okay? So what happens to people is, for example, before we tackle leukemia, let's talk about the more popular and very common na breast cancer. Ang breast cancer will not just come out as a big tumor in the breast immediately. It will start out as a small lump, maybe like a mongo seed or maybe like a corn-sized tumor, and then it grows and grows and grows. Why does it grow? Because the abnormal cell will give rise to more daughter abnormal cells. That's why it keeps growing and growing and growing. Now, let us talk of leukemia. The same thing. The white blood cells gives rise to abnormal, immature white blood cells. There is no more maturity that happens. And what will the body need now to regenerate and repair itself if we are not going to give something as nutritious as colostrum? So, I have several leukemia patients. What is the treatment that is being given to leukemia right now? Do you know what? Chemotherapy. Some will succeed, some will not succeed. Do you remember there is a very famous Filipino rapper who is a host in one TV show during lunchtime? He developed leukemia. He did the chemotherapy, and the result is, you know already. Di ba? That is why people with whatever form of tumors, cancers, lymphoma, leukemia, will benefit from a natural colostrum.
Okay, another question, Doc. Can our immunoglobulins coming from alpha lipid lifeline colostrum neutralize cancer cells?
Neutralize, meaning kill it. Is that what we're trying to say?
I think so, yeah.
All right. Well, there is a lifespan for all cells, whether it is cancer cells or normal cells. They grow and then they die. They grow and then they die. Taking a colostrum product will hasten the death of the cancer cells. And I think that is a better term than neutralize.
Okay, Doc. So for recovering patients, like yung mom nung nagtatanong, no, who is currently in ICU daw, with NGT, is it recommended to give alpha lipid lifeline colostrum? Naka-NGT daw.
Do it. Do it, please. Now, this is a problem. In the ICU, doctors will only want that they give food coming from the hospital preparation. Nakita niyo na ba kung ano pinapakain sa mga naka-confine o admit na pasyente? May kanin, may isang gulay na nakahiga na, may karne, ang taba ganito kakapal, tapos nagsiswimming sa mantika. And that is the kind of food, no, that is being given to admitted and hospitalized patients. Now, supposing you are going to visit a person admitted to hospital and you pass by the lobby, do you know what you find in the lobby that you can give to the patient? You will find donuts, you will find burger, food that will make that person sicker. The hospital food is like airline food. It's not really nutritious. Now, the problem is, in the ICU, sometimes nurses will not allow you to give other foods aside from the food that they give. But if you talk nicely to the nurses, you can probably sprinkle a scoop of the alpha lipid to whatever porridge or whatever food that they are giving. So if you have a relative there, try it, do it. Nakukuha sa usapan yung mga nurses na yan. It doesn't have to go to the doctor. Kaibiganin nyo yung mga nurses na naka-duty. At sa kanya nyo ibigay yung pasalubong ng mga donut and burgers. Para BFF kayo.
Doc, ilang years mo na piniprescribe ang colostrum sa patients mo?
Well, since I learned about it, and I would say almost 5.5 years. And that is the time that I learned about it.
Mm.
And not only that, hindi ko lang piniprescribe on my own patient. I have been lecturing about it before and prescribing it to all the ones who are also attending. And because they ask me about their illnesses, I tell them, add this to whatever medicine you're taking. If you're not sick yet, so much the better. Start taking this because prevention is the best form of cure.
Okay. Doc, regarding kidney, okay, may dalawang question dito, related sila. Is it possible that colostrum can restore a kidney with chronic kidney disease? Tapos yung isa naman, sabi niya, why are some doctors not allowing colostrum dun sa may mga kidney failure, especially those who are doing dialysis?
Because, I'll answer the second question first. Honestly, I'll be honest, real talk tayo. In the 10 years that we study, we only devoted less than 6 months in biochemistry studying nutrition. In the 10 years that we are studying, we devoted more than 3 years studying about synthetic medicine. So the answer there is, a lot of us doctors, unless you study very well about nutrition, will not realize the value of supplementation, including colostrum, for all kinds of patients, including CKD or chronic kidney diseases. Will I prescribe colostrum to someone undergoing dialysis? Most definitely, because colostrum is not a big protein molecule. It will not hamper the function of the remaining kidney cells. It will not block the function of the kidney. CKD patients get thinner and thinner. Hindi nyo ba napupuna yung mga nagdadialysis? Ang iitim nila. Di ba?
Yep.
Tuyot na tuyot ang balat nila. Ang mukha nila zombie-like. And then when they walk, zombie-like also. Hinihila yung kanilang paa. And when you talk to them, they have no energy. What food are you going to give this kind of kidney patients? Lugaw? No. They need a lot of nutrition. Ang pinagbabawal sa CKD patients is taking in a lot of fluids, more than 2 liters per day. So, i-incorporate mo yung isang baso ng colostrum doon sa kanyang allowable limit of fluid intake per day. And that is the solution. If they say, o sige, ang allowed sa'yo is only 1.5 liters per day. Therefore, doon sa 0.5, makihati ka pa. 1 o 2 baso noon, instead of water, make it a healthy drink. Why will you give plain water to a CKD patient? Wala siyang makukuha doon na masyadong sustansya, except the water. Then add something to that water. Nakukuha po ninyo. I hope you get it.
Okay. Doc, regarding insomnia, can colostrum help?
Well, they say milk helps a lot in us getting sleep? Well, kasi ang milk contains a certain kind of amino acid. It's called tryptophan, and it calms down the nerves and makes us prone to getting sleepy. And syempre, ang colostrum is a powerful milk. It contains all these amino acids, including tryptophan. So if we take it warm before bedtime, it may help initiate sleep.
Okay, Doc, 5 minutes na lang Pipili lang ako ng mga ibang question. Bear with us. Daming questions. So, merong isa dito, what is the possibility daw of re-infection? Nagka-COVID na siya. If nagtitake ng colostrum, is it possible na ma-infect pa din daw ng COVID, especially with the Delta variant?
Then ask me personally. I had COVID. I am most likely had Delta because it is the one that is easily transmissible. Now, remember the time that you developed beke? Tandaan niyo nagkaroon kayo ng beke? Natandaan niyo ba nung nagkaroon kayo ng chickenpox? Natandaan niyo ba nagkaroon kayo ng measles?
Mhm.
When you develop immunity against those, there's less chance that you will get beke again. You may, but very small chance. Do you follow?
Mhm.
Ganon din sa chickenpox, di ba? Less chance. Ganon din sa COVID because our body develops natural immunity against it. Kaya nga lang, sinasabi nila that there are many variants of COVID. If I got Delta and I am immune to Delta, if Mu or Mu is going to come in, baka hindi kayang kilala ng aking natural immunity. Therefore, I will need help. And that help can come from something that is nutritious, gaya ng colostrum. But definitely, yung body ko, kilala na ang coronavirus. I hope you follow.
Mhm.
Okay, Doc. For pregnant women, is it safe to take colostrum? And what are the dosages?
I'll be giving you a real talk. That is an hypocritical question. Come on. I see pregnant women coming out of this coffee shop that costs 150 pesos per cup, per mug. What is the nutrition there? I see women, pregnant women, anumang stage nila coming out from a burger house, drinking all of these cola drinks. Come on, what is the nutrition there? And yet you question colostrum.
True.
I don't think I have to answer that one.
Okay, next question. Alpha Lipid Lifeline contains dextrose, which is a form of simple sugar. Does it have impact on blood sugar levels?
Not as much as the rice that we are eating so much of. So, wag nating sisihin ang isang bagay and yet we eat 3 cups of rice. No, we can adjust everything, no, but it does not raise your sugar that high. So wag nating isipin na this will cause me diabetes or this will increase my blood sugar kasi I'm already diabetic. Most probably, yung pagtaas ng ating sugar comes from other food sources. Alam mo naman ng Pilipino, on top of rice, naglalaman sila ng pansit. And then on top of the pansit, ganito ang birthday party sa atin eh. May rice, may nakapatong na pansit, and then may tinapay, ang palaman spaghetti. And that is the usual happy birthday na natin. All carbs.
So, Doc, if you're diabetic, meaning pwede siyang uminom ng colostrum.
Well, most definitely. Actually, Miss Cynthia, there are only 2 instances, I think. Only 2 instances. And this is a reality. I have seen this in actuality, but in very rare cases, na hindi pwede siguro ang colostrum. 1, if you have an imperforated anus, that means pinanganak ka, walang butas yung puwet mo. And secondly, kung walang butas yung bibig mo. There are children na pinapanganak walang butas ang puwet. We have to operate on them. Yun siguro bawal kasi walang butas ang puwet. O kaya walang butas yung bibig.
Okay, so yung ibang questions dito, I think nasagot na ni Doc. Yung ito na lang, Doc. About autism or the children, yung mga special child, Doc, will they
Autism.
benefit from colostrum?
Definitely. Most definitely. Autism is a genetic disorder. That means somewhere in the chromosome of that person, nagkaroon ng hindi magandang linkage, so nagkaroon ng autism. There are some studies linking autism with certain forms of vaccines during childhood. Maybe yes, maybe no. They're not doing studies on it. But definitely, autism will be helped with colostrum. Hindi lang autism. I have patients and I have worked with a group. Dito sa Alabang, there is a group called El Sigaches Village. Do you know that place? El Sigaches Village, that is in Alabang Town Center. There we adopt a lot of Down syndrome patients. Yung tawag nila mongoloid or Down syndrome. Almost every birthday ko, I go there and we do some projects with them. Nakakalungkot dahil iniiwan na lang sila ng mga nanay nila doon sa pintuan dahil ayaw tanggapin na ang anak nila has Down syndrome or sometimes with autism. These are children that can be helped with colostrum.
Okay, last question, and it's about you. The last time I saw Dr. Bien was 2012, and he didn't change a bit. What is your secret daw, Doc, for staying and looking young?
Well, I gave you a presentation on that one. And keep yourself happy. Thinking positively. When you wake up in the morning, alam nyo, doon sa mga may kakilalang may COVID and hopefully will not suffer COVID. That is 2 weeks na ako ay naka-isolate. Every night that I sleep, nagdarasal ako, Dok, ay Lord, gisingin mo ako bukas ha. Kasi akala ko hindi na ako gigising bukas eh. Kasi ang higa ko padapa. I don't know if you have seen my YouTube. If you have not seen my YouTube, just look for my name, Dr. Edwin Bien sa YouTube. You will see that. Pinost ko, ang higa ko padapa, nakataas ang puwet ko kasi wala akong oxygen. And that is my way para makahinga ako. Padapa. Okay. I will pray every night na, Lord, gisingin mo ko. And then in the morning, pag gising ko, sasabihin ko, wow! Thank you, nagising ako. And I smile. And I know that I will be able to get over with. Ganyan din po tayo. Whatever you're suffering right now, if there are people here who are ill of some sort, think positively that you'll be able to get over this with your faith and with the right kind of nutrition. Smile lagi. Every day sa bagong gising, di ba?
Okay, so thank you very much, Dr. Bien. Ang dami naming natutunan tonight. And marami pang questions but we ran out of time. As you know, hindi lang ito yung event na pwede nating, nagagawin natin with Dr. Bien. Okay, we will schedule another event with him and maybe you can ask your questions sa susunod nating Zoom meeting with him. And I see that we have guests here. So, i-share ko lang how you can sign up, all right, if you are not a member yet. So, we have offices, of course, here in the Philippines. New Image has been here we are celebrating our 27th year this year, okay? And yung New Image International is already 37 years. Okay, so hindi na tayo bago when it comes to the network marketing industry. And we have 3 offices, which is from Manila, Davao, and we also have in Cagayan de Oro. Okay, so it's so easy to get products. Plus, we have product distribution centers na pwede niyong pagkunan ng mga products natin. So if you're not a member yet, you can sign up by purchasing the sign-up kit or the membership kit for only 3,500. Okay, it's very cheap compared to other companies. Some companies would charge you 20,000, 30,000, pero dito 3,500 and you're a member already. Meron na siyang Alpha Lipid Lifeline, isang can, plus may shaker with reading materials, okay? And of course, may bag na rin yan. And you will have an access to your own online business resource, okay? Where you can check yung activities nyo, kung ano yung prices ng products, ano ba yung mga videos available, how many people signed up in your organization. So, you can see everything there, plus sa mobile app, makikita nyo rin. And then, of course, makakakuha na kayo ng discount. Alright? You will be able to get discount when you become a member. And of course, you can share this and earn 33% profit. Okay? We will discuss this in detail when you attend our wellness seminar. Every Wednesday, meron tayong wellness seminar. Okay, so if you want to learn more about colostrum, about our company, please attend on Wednesday. Always on our Facebook page kung paano kayo makaka-access sa ating mga Zoom meetings. It's gonna be conducted by our regional coordinator. So attend that on Wednesday next week, 8 o'clock p.m. Okay, so before we do the raffle, I would like you to watch this video. Okay, this is for all the guests who are here.
Colostrum truly is amazing. The whole family can improve their health with this powerful, scientifically proven superfood. Take a look at our top 6 reasons to include colostrum into your day. Number 1, healthy immunity. Colostrum supports a healthy immune system. It's one of colostrum's biggest benefits. Taking colostrum daily ensures the body is primed to resist a wide variety of bugs, ills and chills. Among the immune components in colostrum are antibodies called immunoglobulins, lactoferrin, proline-rich polypeptides, cytokines and growth factors, as well as proteins, vitamins and minerals. Number 2, digestive health. Studies have highlighted the benefit of bovine colostrum to help support a healthy digestive system, optimizing the absorption of vitamins and minerals from food and offering natural resistance against various pathogens that enter through the gut. Number 3, heart health. Colostrum can help lower LDL cholesterol and reduce the risk of cardiovascular disease. Research has also shown that heart disease can involve immune sensitization to cardiac antigens, meaning the immune system may play a part in heart disease. The PRPs found in colostrum may have a role in reversing heart disease. Number 4, bone health. Lactoferrin is a protein found in colostrum. A number of in vitro and animal studies have found that both human and cow lactoferrin supports healthy osteoblasts and normal bone formation. It is also thought that lactoferrin may maintain healthy osteogenic activity, which has a protective effect on bone mass, especially in women. Number 5, healthy aging. Colostrum supports gut health, healthy immunity, and influences the health of our stem cells, all things that contribute to healthy aging and longevity. Number 6, healing and repair. Colostrum can support your body's healing and repair processes, the mucosal cell lining, heart tissue, and blood vessels. It is great for sports people of all levels. Often during intense exercise, muscles suffer micro tears as part of the muscle building process. More serious tears or strains can occur to the muscles, tendons, and ligaments with overuse or incorrect training. Colostrum supports the natural, healthy repair of tissues. Including colostrum in your daily routine is easy with Alpha Lipid Lifeline, a delicious breakfast shake with added probiotics, vitamins and minerals. Or Alpha Lipid Colostrum capsules and tablets for those on the go. Health, wellness, colostrum. From New Zealand to the world.
first and foremost, I would like to thank our special guest speaker tonight, Dr. Edwin Bien. We are so blessed to have him with us. I know that he's very in demand and of course well respected in the medical field, and we are so happy to have Dr. Bien with us. Two things that resonated with me during the talk of Dr. Bien. One is, why are doctors not promoting it? Sabi nga ni Dr. Bien, most of the doctors are not knowledgeable when it comes to supplementation. Kaya hindi nila nire-reseta or piniprescribe ang colostrum. Second, yan bang colostrum naman may side effect? Kita nyo naman ang sagot ni Dr. Bien. Ikaw naman kung ano-ano ang ini-ingest kung coffee dyan sa tabi, burger dyan sa tabi, tapos itong first milk natin when we were born, tinatanong mo kung masama sa atin yan. Hindi ko na sasagutin yan. Yan ang mga medyo magandang tanong.
That's right.
Tonight, we learned so much from Dr. Bien. And again, maraming salamat po, Dr. Bien. Mabuhay ka. And I hope this will not be the last. You're a great speaker. Naku, kulang ang oras eh. Talagang hindi ka aantukin sa paliwanag ni Dr. Bien. Napakalinaw. Nata-translate niya o na-interpret niya sa layman's language yung mga medical, complicated terms ng medicine. Maraming salamat po, Dr. Edwin Bien.
All right, thank you, Boyet, and thank you, Dr. Bien, for being with
My
us.
pleasure.
Maraming
God bless
salamat
everyone.
po, Doc Bien.